Sorry, I don't know how to pause it. I was just checking on one of my nurses in LA, and they're fine. They're great. Come back. Okay, they are finishing up chemical peel over here. It is really quick and easy to apply, and then we have you sit for a few minutes. And when she finishes with that, she's gonna do her all natural filler. You guys wanna see? This is pretty green color. She's just applying it, and then when she's going to rub it in on the skin, it just gets slightly tacky, it's slightly sticky. We just did your forehead. What does that feel like on your forehead?
It just feels nice and tight.
Nice and tight.
Yeah.
I love this one. I feel like when I do this, you get it off the finger. You got some on your glove. Use it too. Don't waste it. I feel like when I do this, I am super glowy. So I love it. I feel like I love the laser on its own, but this took it to the next level with my skin with the chemical peel without having to have crazy peeling, which is important to me just because I don't like to peel. If you want to have crazy peeling, we can start making it more aggressive. You can combine it same day with microneedling, with a laser. I have some patients that want that, and they do peel. As you can see through there. It might feel slightly tingly, but it shouldn't feel anything too aggressive. How do you feel, Sabrina?
It's starting to feel like a slight tingle.
Where do you feel it?
Mostly on my cheek.
Okay. Sometimes around the mouth, like on the smile lines, people will feel it. The tingling should just be like pretty subtle. And so some patients will come in and they might alternate their treatments. They might be doing the chemical peel 1 month followed by a hydrofacial because they are getting ready for their birthday dinner and they just want to have glassy glow. So this is why when you come in, we're always talking about your skin, where you're at, what your goals are. Should we adjust anything? Do you want to be more aggressive? Because right now you have some downtime and you're not going to be out in the sun or forward facing. We're always talking to you about your goals. It's really important to us. Even one of our patients earlier, when we were going through her skin regimen and her skin treatment plan, she was like, every med spa I've gone to before, like they don't say anything to me. They just kind of like do the treatment. She's like, I don't know what's going on. They're not asking me these questions. And I was like, oh no, we want you to understand what we're doing, why we're doing. We want you to be able to make an informed decision about these treatments. We're not doing these treatments randomly. There's a reason for all of it, and you are included in the conversation. So we ask a lot of questions about you, your lifestyle, what's going on, what are you prepping for, so we can make sure that these treatments are going to serve you and where you're at and where you're trying to be with your skin goals. You'll see them doing the all natural EZ Gel PRF here shortly. For fresh air, he said, are there any non-invasive procedures with similar outcomes to Botox and filler? So this is, I think you're going to really like the all natural filler, the EZ Gel that you'll see Samantha and Sabrina do here shortly. I might have to step out for a patient, but that one is a filler created completely from your own blood. Before I logged off this last live, I can walk back here and show you. We have one of our estheticians is prepping the PRF EZ Gel now for this patient here. So it's a filler made completely from you. We draw your blood, we take out your growth factors, your stem cells, we heat it, we cool it so it makes a gel, and then wherever we inject that in the face, it can be smile lines, it can be under eyes, you are going to make new collagen in those areas over time. So new collagen is going to help keep the skin looking full, bouncy, youthful, give you some of that volume. And so can I show here? This is the EZ Gel. So nothing else is mixed inside of this besides what blood components from you. So your growth factors, your stem cells. The girls are going to bring that into the room, and you will be able to see Samantha inject this into the patient. I think that they're going to do the under eyes and the mid face, maybe smile lines. I wasn't fully for their conversation to know all the spots, but this is probably one of the most like popular treatments. Any of our skin treatments everybody loves, but one of our most popular treatments in our office. It's a treatment that is tried and true by me and I love, and I brought it on because patients were asking us for it. I am a Botox and filler injector, and I have been since 2013. I've been pregnant breastfeeding the past 3 years, so I was only able to do the all natural filler. I was put in a position where I can't do anything else, and over time I was like, whoa, I think this is working. For now being 38, this is my third kid, I breastfeed them all for 2 to 2.5 years. Usually I feel pretty sunken, hollow, and I can't wait to get filler. I'm trying to like get the kid off of me so I can go do some stuff. But with doing skin treatments, with doing the all natural filler, I'm like, I don't feel so beat up as I have in the other two. So that was the answer for you, Fresher. Let me see if there's other questions I have missed. Do I travel at all? So I am supposed to be in Los Angeles. That's where I live, and that is where our 2 main offices are. We have a clinic in Mar Vista and then in Torrance in LA. And then we just opened our beautiful office in Las Vegas. And so I'm in Las Vegas today. I come in, I see some patients in Vegas a few times a month, but really you will be seeing in Vegas like our amazing team here that I have trained, and they've trained with me in LA and Vegas. These girls are awesome. But those are the spots I travel. Realistically, a lot of our patients travel from out of state, out of town, out of country to come to our clinic. Every day I'm in clinic, I see somebody from out of state, out of town, out of country that has flown in or traveled in from far, and they find us from social media. We're really big on our office about natural aesthetics, safe outcomes. We want you to look like you. We want you to look refreshed, never overdone. We want your face to look like you. We don't want every face looking the same. If you look at our team, everybody's beautiful and looks natural, and nobody has the same face. I think when people think about aesthetics, they think it's all going to be cheeks and Botox and chin frozen. I'm like, no, it's not that. Like, we want it to look like you and look fresh. And we try to showcase and highlight our patients who are so lovely and like share their before and afters and make videos and share their experiences. We try to show like natural looking results on all skin types, all skin tones, where you wouldn't know what they did, but they just look a little bit more glam, a little bit more refreshed. That's always our goal. Someone says, I hate, Fernanda, don't say you hate your under eyes. Is PRP worth it? What's better, Radiesse or Sculptra? So those are a few questions. So for under eyes, if you feel hollow, if you feel sunken, if you feel tired, you can do something like filler, like we did here. She did filler as well. And so filler, hyaluronic acid. Filler is going to help volumize, plump, lift an area wherever we place it. You can see immediate results with it. The PRF or the PRP you're talking about, that one is our EZ Gel, all natural filler made completely from you. So we draw your blood, we spin it down, we take out our growth factors, our stem cells. We can go see Samantha do this in a second. Wherever we inject it, new collagen will be formed. New collagen is going to help give you a little bit more volume in the areas you treat. So if you're not a candidate for filler, or if you don't want to do filler, consider the EZ Gel PRF all natural filler. You wouldn't be a candidate for filler if you swell a lot underneath your eyes, if you cry a lot, if you have bad allergies. Anybody that retains a lot of water around their eyes, they're not good candidates for filler because filler binds water. So keep that in mind as you're considering these treatments and just making sure whatever you do that you're the right candidate for them. You don't want to get something and like you have a worse outcome. You end up looking worse than if you had just not done it at all. Someone said, can they still achieve great skin doing microneedling without PRP? Yes, you can, Anita. You can totally do that. Yes, you can. And then the other question was, what's better, Radiesse or Sculptra? So these are two different type of injectables. Radiesse is a calcium-based filler. Radiesse mimics bone. I like this, and I use it a lot on my patients. I can show you a lot of patients in their before and after. So we do it cheeks, chins, jawlines, anywhere I want like the most projection. You guys good?
She's got like 2 minutes.
She's got 2 minutes.
Yeah.
Can I see your skin?
Mm-hmm.
Okay, so chemical peel is
So
on.
glowy.
So glowy. And then in a couple minutes, they're going to wipe it off. What does it feel like right now?
It's just slight tingles.
Slight tingling.
Yeah.
You're going to feel it a little bit more intense because you and Samantha did laser right before.
Yes.
So she's going to wipe it off. And then you're going to be doing your all natural filler.
Yes, I'm so excited.
Samantha, you want to tell us where you're going to do that?
Yes. So let me pop in here. So we're going to do the all natural filler. She's really excited about that. She really wants to do under the eyes, right?
Yes.
She's got little kids, feels like she doesn't get to rest as much, so just wants that refreshed but natural looking appearance. And then we might do a little bit into the cheek. And then I think as far as like smile lines, I think you're okay. So mainly just under the eyes and then through here with that all natural filler.
Okay, I cannot wait to see that. I might be my patient, but I'll let you guys keep seeing what you're doing. So you'll see that in a few minutes after she wipes off the chemical peel. So the first thing you did was the laser, you did the chemical peel, and then we're getting ready to clean that off and do your all natural filler.
Yes.
So that is, I have it set up right here. This was made completely from her own blood and growth factors. So thank you for sharing. Okay, I came out to talk about Radiesse and okay, Radiesse, calcium-based filler, mimics bone. I like it on cheeks, chin, jawline. With when I want structure, it gives the most lift out of any of the products that we have FDA approved in the United States. I use this on a lot of women of color, a lot of people that naturally have fullness in their face because it's the most structured product. If we use other products that are a little too soft, it could end up looking pudgy on the face and not give us like the lifted appearance. So we want to use the right product in the right patient. I don't want to just have somebody say, my friend did this, so I want the same product. I'm like, no, that's not the same face. Even if it's your twin sister, I need to see your face, ask you about your background, ask about you and your lifestyle, your goals, and then determine what product, what treatment we're going to do. So Radiesse is there. Sculptra is a collagen stimulator. Wherever we inject it, it'll make new collagen over time. The cool thing about Radiesse, that product I was mentioning a few minutes ago, that helps to give us like the structured look and the structured lift. Radiesse can also be diluted down. So that's where we take saline, like salt water, and we thin it out basically, and wherever we inject that, it'll make new collagen. It's not going to give us a huge structured lift as if we didn't water it down, but it's going to make new collagen. Think of it as a fertilizer wherever we place it. We use both in our practice. I don't like to get on here and talk products and who I like more, but I really do like Radiesse. I have it all. When I do filler, remember I haven't had filler in 3 years because I was pregnant breastfeeding. But when I do filler, I like Radiesse for the structure. Out of Dilute Radiesse and Sculptra, I feel like I can see the results from Dilute Radiesse a little bit quicker. However, I use Sculptra and patients love it too. So there's options, and we really kind of have to assess you, your skin, your goals. We ask a bunch of questions before we just decide pick which product. Yes, Alex, we do chemical peel, and I hope you just saw that we were showing one of the patients that has it on her skin. Her skin looks super glassy. They're going to wipe it down. Her skin is going to glow today, tomorrow, and she might have a little bit of slight flaking, slight peeling. It's not going to be this excessive peeling peel. So we use the Bio Repeel in our office. Safe for all skin types, safe for all skin tones. You can combine it same day with any of the treatments that we have in our office. And most of the patients that come to see us are stacking treatments on the same day. We're working on different layers in the skin. We're working to try to target different things. So that's where we're going to be using different modalities. Okay, trust in God. I love that. Me too. How do we get rid of the marionette lines? So marionette lines are these lines at the corners of the mouth. As we get old, we'll get little shadows of them in our late 20s, 30s. As we get older, they start to look more downturned, look more sad. They look deeper. People feel like, oh, it looks like I'm mad or I'm sad, and I'm not. What can we do for those? Through that, we can use your all-natural filler, one made completely from your own blood. We can do regular filler if you want an immediate lift. We can do collagen stimulators. So we kind of have to, we have to assess your skin, see what's going on, what your goals are before we determine which one is right for you. But that can look really nice, and I will see if I can find a photo real quick of a patient to show you what marionette line softening can look like. I am just kind of walking through the office, and we have some great patients on our walls that have shared their photos. So this one is good to show marionette lines and what changes can be done. You guys might see her online, Sujia, that's our girl. I've been treating her for a few years. Okay, anyway, these little lines around the mouth, when we feel like we look sad or tired, this is what marionette lines are, and that's where we're trying to soften. So for Sujia, we have done different treatments over time, including skin treatments, but really we've worked on some filler through the mid-face, through the smile lines, her lips, the corners of the mouth, her chin, and then this area we call pre-jowl sulcus to connect the chin to the jawline. I think I have another view of her somewhere in here in the office, but also you can find it on my page. We've done videos, we've talked about the things that we've done over time. And this is what I'm talking about. I want it to look like you. I want it to look natural. I want it to look fresh. If you just saw this person on the street, you wouldn't think she's had a bunch of Botox and filler in her face. But realistically, we've done a bunch of stuff, but she still looks like she looks like her. And that's always the goal. That's the intention. We want to maintain your features and have you be true to yourself. Okay, so let me see if I can hit some other questions up. Would I recommend regular microneedling or RF microneedling for acne scars? I think I gotta assess your scars. You can get pretty far with doing regular microneedling. RF microneedling, we don't offer it in our office. I think before you do it, just make sure you do a good consult with a provider. Ask to see pictures of people that look like you. All skin types, all skin tones. Is this going to be safe for me? What are the risks with doing that? Some of the risks I have heard with doing RF microneedling are people saying fat loss in their skin. Not saying this is totally going to happen, but you just want to be mindful of these rare risks that can occur. And then if that were to happen, what do you do with it? So that's for acne scars. Other things for acne scars, use your retinoid, your tretinoin, your retinol. That's going to help. Make sure you're first getting rid of acne. So that's where you can use the laser that you saw earlier. So Aerolase laser, we want to first calm down all the acne before we start treating the scars. So that's something to keep in mind. Okay, let me see if there's other masseter, Botox, and chin filler on round-faced women. I definitely haven't. Let me see if I can find one, if I have one up on these walls that are big and I can show you. Masseter. Okay. Round face. Okay, so they're going to start PRF, so I'm going to show you guys some of that. I have pictures of that for sure. Here's a quick chin filler on somebody. So here's chin. It looks like we did her jawline afterwards. We didn't. We just elongated her chin and helped to balance her profile. I will find more. Here's another chin. So pretty. Everybody's so dang beautiful, but another chin. So on a patient that comes in like this, if they say, I want lip filler, I'm like, no, I don't want to just do more to your lips, or else it's going to have a ducky appearance. The lips are going to protrude even more past your chin, and that's going to look off. This is why we don't spot treat. We want to consider your full face and assess your face. So for her, we did a little bit of filler into her chin to help elongate the jawline, and it just helps to balance her profile, her side profile. So now the lips are not protruding forward. This girl's freaking beautiful with nothing, obviously, dang, but you can see. Let me show you another chin filler. These are ones that I have up in big right now that you can see in the office. On our page or in the office, we can show you even more. Okay, I'm gonna have to go for my patient right now. Another chin filler, another mid-face, smile lines. You guys can go into that other one, and then, okay, they're getting my patient ready, and you guys are gonna do EZ Gel while my patient's getting room. Okay, I just wanted to show it.
Can I ask a quick question?
Yeah.
She's now looking at your beautiful pictures here.
I love her chin.
And she's looking
Hit the
like
chin
she
up.
wants to do the
We were
chin.
just talking about chin in the hallway. There's
Can
another
we-
girl.
Can we do a little chin action then?
Do it. Okay, we're gonna do some chin action as well. Okay, you wiped.
Yeah,
You want
she's-
some ice? You want me to get ice for you?
Oh, I'll grab your eyes.
Okay, while you grab ice, I'll talk through some of these other. Somebody had asked for chin filler on a fuller face patient. She has a fuller face, so again, chin sitting back some. When we bring it forward with a little filler, it just helps elongate the jawline, helps to support the lips. I feel like her lips look fuller without even doing her lips, but like we just bring some light to the lower face. This is the one that you saw that you liked, this one?
Yes, such a
Okay.
beautiful thing.
She's so pretty. Again, these girls look great. They don't need anything. I get it. People are like, they don't need anything. I know, nobody needs anything. We don't. Like, you're beautiful the way God made you. I completely feel that. But a little filler. So this girl just felt like she looked a little tired. I think she had finished like law school. So we done some filler through her mid-face, a little lip pop. But remember I showed you the girl in the hallway in the other photo. I don't want to have big lips protruding past the chin or it's not going to look right. We want to make sure we have a little bit of light and balance in our lower face. So when we're treating here, we're not just spot treating. We're considering your full face. Samantha, there. You guys starting on chin or are you starting on mid-face?
I need a little more cleanser.
Okay, she's wiping down. Oh, the rapid course is there. Here's another.
We're going to start under the eye.
Under the eyes, okay. Chin filler, you can see, I get it. She's gorgeous. She needs nothing. We know she's so beautiful. However, by doing some filler into the chin, it elongates her chin, helps to balance her naturally fuller cheeks that she has. Just bring some highlight to the lower face. I love this patient. This patient was really fun. She had lost 100 pounds. I had done like a Beauty for All campaign, and I was like, I'm just treating some people just to show all skin types, all skin tones, and aesthetics. And she was one of our patients. She'd lost 100 pounds. She was like, I'm really happy with my body. I just feel like my face is not matching my body the way I want it to. I'm not feeling as confident as before when my face was fuller. So we did filler into her under eyes, her cheeks, her lips. She wanted a little pop into her chin to bring her chin forward, and at the corners of the mouth, the little marionette lines. So when we do these treatments, right now she's gonna look a little extra because she's swollen. So I tell you, she's got the same picture, same clothes on. So immediately after, it's gonna look a little exaggerated. You're gonna swell, you might bruise. I expect that. 2 to 3 weeks after your treatment, you're gonna have a pretty good idea of what the outcomes are. It just needs time to settle. At 6 to 8 weeks is when it's fully settled. You won't feel the product and all of that. That is where we can add more if you want. So I'm going to tap the shoulder for Sabrina. I don't know if they're going to take me off of live if I'm showing injections. Hopefully not, but they might. God willing, no. Don't look if you don't want, but right now, she's blocking it. You can't really see it. Samantha is doing a little bit of the all-natural filler. This is made completely from our patient Sabrina's blood, her growth factors, her stem cells. They drew the blood. We spun it in the centrifuge. I showed you that one earlier. And then they took out her growth factors, her stem cells. We heat it. We cool it. Wherever Samantha injects this today, we're going to get new collagen in those areas. I'm just tapping her shoulder as a little distraction technique. We also give ice. With the all-natural filler, it's going to look a little swollen, a little full right after. Some people are like, what the heck? I don't like this. Other people, if they're really sunken or volume deficit, they like the swell. The swelling with this, 3 to 5 days typically. Usually the second day is the worst. I am going to go because I have a patient in there. They're just taking the pictures. Usually second day is the worst swelling right when you wake up. After you get moving around in the day, the swelling tends to go down. After 3 to 5 days, I've never heard anybody with complaints beyond that. They're like, oh, maybe I was bruised, but it's not temperamental the way filler can be. I love filler, so I'm not going to down it, but like filler underneath the eyes, it takes more time to settle. In 2 to 3 weeks, you might have little bumps, they settle. Remember, you have to be the right candidate for it. If you are not the right candidate, your filler outcomes are going to look really bad. So I would use this if possible, if you can.
I know, they scratch them all.
Yeah, I would switch it if you can. If it doesn't, then you can switch that one. We try to use the smallest needle if we can. Sometimes, yeah. How's that one? Did you use that on the other poke? Mm-hmm. Okay. And if not, I would do a 27 from there. Okay, let me know. I have not, no one said no link in bio. Someone said no link in bio to book. So call or text the number on the top of the page. Our team can help you get set up. There's a virtual consult that you can book online. We just like to consult with our patients before they come in to help go through questions, goals, give you tips on what to expect, how to prep for treatments. If you know, like I know I've got acne, I know I've done enough research. A lot of people are like, I've been watching you for some years. I already know I want the laser. I know I've seen it before and afters. I want that, or I want the natural filler. If you know what you want, text the number and then we'll book you. We have 3 locations. 2 are in Los Angeles and then 1 is in Las Vegas.
Yes.
And we can see beautiful Samantha. Okay, you've been giving some pokes.
Yes.
I'm not trying to show the pokes on there because I don't want them to ban us.
Yes.
But how is it?
I think it's good.
Okay.
It's not bruising. It's pretty minimal.
Pretty minimal, pretty chill. You already finished your laser, your chemical pill, Samantha.
Yeah.
Love her over here.
She's been great.
She's so calm and so loving, and you will like it. So, okay, how much do we charge per unit? How much for Botox? Okay, sorry. Okay, Botox, it's different in LA versus Vegas. So in Vegas, there's a rule where you have to buy the whole vial or the whole half a vial. So our 50 unit Botox price is $650. The 100 unit Botox vial price is $1,300. In LA, we charge per unit. It's $13 per unit with our nurses, and then with me, it is $15 per unit. So she's doing some little pokes now. Remember, this is the all-natural filler. This is for collagen stimulation wherever we inject it. She's going to have a little bit of swelling, some bruising. That is all normal. Dr. Jill, I hope I can see you soon. Someone said, how tall am I? I am 5'9". And a lot of times people think I'm short, and then they come in, they're like, oh, you're taller than I thought. Okay. Let me see if there's other ones. Masseter Botox. Let me talk about that before I go see this patient that is getting roomed. Masseter Botox. This is where we're doing Botox into our jaw muscles right here. I don't know if I have a big picture up on the walls, but we have, it's probably somewhere in one of these rooms. I try to showcase real people, real results, so you can see these are our patients. But Masseter Botox is our jaw muscle here. Our jaw muscle is used when we're chewing, talking, all of that. If you're overusing it, you might have symptoms like clenching, headaches, teeth grinding, jaw pain, all of that. Why are you nodding? You got that?
I have that. I'm like,
Why
why did I do that?
She's saying that she has that. If you have those symptoms, you might feel pain here or in your temporalis muscle. So both of those are chewing muscles. We do this on patients every day that just feel too tight in those muscles. When you Botox it, it's going to relax the muscles and it's going to help alleviate those symptoms of clenching, headaches, teeth grinding, jaw pain. Usually lasts around 3 to 4 months, and then you can always do more later if you want. But a lot of people have said that changes their lives. They're like, I don't wake up, I don't have pain, I can go to work and school and I can function normally. I'm not breaking teeth. My dentist is not saying that I'm grinding my teeth down. Like, these are all the things I hear when they're coming in. Why is she still nodding?
I mean, yes, because my dentist, we just had this talk. Okay, I'm grinding my teeth. I now have a mouth retainer. Should have just come and seen the spa.
This is exactly it. So a lot of people are like, I grind through my mouth guard. I've broken my mouth guard. Then they're like, this is the last resort. And then they're like, whoa, this actually did what it needed to do. Samantha doing some injections. I might not show it just so we don't get banned on here. Someone said, is my husband also in the medical field? Yes. Did you know that? Have you seen him on here? He is an oral surgeon, and he's actually taught me a lot about Masseter Botox. But he just lets me do my own thing, run around my medical clinics with my girls. We don't need them in here. No, men are great. We treatment do. How many units typically for jaw slimming or TMJ? So TMJ, depending on how strong your muscles are, how severe your symptoms are, usually most patients are doing 20 to 30 units per side. They'll let you know, go see this patient. And in their temporalis, if they have pain here, it might be 12 to 25 per side. And so we have to assess you, we have to assess what's going on, what you've tried and failed, and yeah. Okay, I'm going to get ready to see this patient. And yes, the tapping that I'm doing is to distract from the pokes. But I mean, she's doing great. And Samantha looks so beautiful. Looks so nice. Yes. How can I slim my face, not my jaw? I gotta see your face to know. If you feel like your face, if somebody comes in and they tell me my face is naturally just round, I'm kind of looking at, can I make an illusion of a lift through their cheeks, not to give more fullness here, but laterally. And if their chin is short, putting a little filler here to elongate their jawline to change the highlights on the face. Hard for me to know, and it might be slimming through the jaw to make it look more V-shape. Hard to know 100% without seeing the face. Let me see, these girls have like a little bit fuller faces. I have versions of her like on social, or if you come in the office, we can show you. But by just bringing her chin forward, her face looks a little slimmer. And we also, same thing I just described, a little into her lateral cheek we did. This girl has a fuller face. By doing some into her chin, elongates the chin and jawline, gives them highlight, some balance, makes the face, can make the face look a little slimmer. But yeah, consultations are $150 virtually. And so you can meet with me, my team, we'll go through questions, goals, tips on what to expect, how to prep treatments. You can also come in person. Consultations are $150 with the team, $350 with me. That money goes towards your treatment, which is really nice. So yeah, our patients come in, they do the consult. Most patients are doing treatment that same day. Is there any way to slim the face via Botox, no filler? Botox into your masseters is going to help a face that looks naturally like wide here, kind of more slimmed over time. Usually a couple months out, it'll look a little slimmer. Okay, I'm going to keep coming on here later. And I'm trying to see if there was any that I did. How to book. Call or text the number on the page. I see all the texts that go through, but we also have Mackenzie, Akira, these girls I've been working with in the office side by side for years, and I love them, and they know any and everything, but I see all the texts that come through. You can send, I'm coming. You can send your pictures there. We'll do our consult. Okay, let me know other questions. You can also, like I said, if you DM me or do it to the number, and then I can actually write you back because you can't send pictures on DMs here. Okay, I hope you have a good one. I'll talk to you soon. God bless. Bye.